Good morning, everyone. My name is Caroline LeBlanc, and I'm an analytical economics student at the University of New Hampshire. And today I'm going to be discussing Anthem Blue Cross Blue Shield and their sustainability measures. So to give some context, there are two main issues within the healthcare industry. The first is rising medical expenses. These have been on the rise since the 1960s and 70s, due largely to an increase in demand for such services. This demand was fueled by the passage of Medicaid and Medicare, which increased the amount of people that had access to the services in general. It was also fueled by the overall increase in income in the 1970s. The other key issue is the uninsured population. The amount of uninsured Americans has decreased with the passage and implementation of the Affordable Care Act. However, we have started to see a slight uptick in these numbers recently. As a result, when looking at how sustainable a healthcare insurance company is within this industry, it's important to know what they're doing to address these key issues. So to give some more background on Anthem, Anthem was born out of a merger with WellPoint Health Networks in 2004, and it is the second largest health insurance company in the United States, second only to United Healthcare. And it offers a variety of plans, both in the employer-based market as well as the individual exchange market. And these plans sound like a lot of jargon, but it's basically just describing the relationship between the enrollee, the insurance company, which is Anthem in this case, and the provider that they're in network with. And so the differences mainly lie in pricing strategy, as well as differing amounts in access to care. So when thinking about what the most innovative or sustainable plan that Anthem offers is, it would have to be the Enhanced Personal Healthcare Plan. And this was born only in 2015, so it's pretty recent. And it already accounts for 60% of Anthem's payments to providers. So it's a huge part of their business now. And it also represents that shift in the industry towards VBP, or value-based payment system. And so when thinking about this, basically Anthem is trying to incentivize providers to offer their care, but at lower costs. And the way they do this is they offer caps at the amount that providers can charge per service. And if the provider comes in above that cap, then they'll have to cover the expenses themselves. But if they come in under the cap, then they can make the money back through health savings. And they're also able to ensure the quality of care that their enrollees are getting by offering these quality gates or standards that the providers have to maintain and go by to make sure that they're able to reduce costs, but they're also giving their enrollees the best possible care. And according to the Public Policy Institute that Anthem runs, they've been able to decrease the cost per enrollee in this plan by about 3.3%, which is pretty significant and move in the positive direction, especially when we're looking at that first main issue that we discussed of rising medical expenditures. And you can also see in the graphic just that overall shift in the future towards more value-based payments, which are in the blue and the green. So thinking in more terms of traditional sustainability, Anthem has been able to do a lot to decrease their environmental impact. So they were able to decrease carbon emissions by about 350 tons per square foot between 2013 and 2020, which is pretty remarkable. And they also have many ambitious goals for the future, which is, again, really good. And when thinking about a healthcare company, they're not really producing a good. So most of their energy is going to be going towards data centers or offices that they have. So like this solar farm that you're looking at is in Richmond, Virginia, and is going to be powering one of their new data centers that they have located there. And then more focused on their people initiatives, Anthem runs the Anthem Foundation, which is the philanthropic branch of the company that works alongside nonprofits to give back to the community in various ways. So with the outbreak of the COVID-19 pandemic, they donated about $50 million towards addressing and mitigating this situation. And they also offered about $50 million towards facing the social injustice and racial disparities in the United States. So again, just trying to give back to the community in those various ways. But they also have more hands-on initiatives, or what we would describe as creating shared value. And these look more like informational or educational services, as well as online toolkits for both providers and the public. So My Diverse Patients is an online toolkit for providers that basically works to educate them on the ways to provide the best quality of care for people no matter their backgrounds. In Ubuntu program for emotional wellness, in contrast, is mainly for the public and is a support group for African Americans facing heightened levels of stress. They also have really interesting partnerships in the technology sector. So they're working alongside Apple to actually create an app on the Apple Watch to track asthma, which is really interesting. And they're also working alongside Amazon to create an Amazon Scale, which is basically just allows people to access information about their plan, their payment schedule, ordering prescription drugs in an easier way. So when looking where Anthem's going to go from here, Anthem is a sustainable company. It's ranked one of the highest by the Dow Jones Sustainability Index. But what it has to mainly focus on is how it can be sustainable in an unsustainable industry. There's a lot of issues in the healthcare industry. So what they do now to address those issues will matter not just for Anthem itself, but for all of private insurance companies in the future. Thank you so much and have a great day.